This video shows you how to appropriately prep your patient for a C-section. The entire mons pubis and vertical incision site should be shaved before the patient enters the OR. You do not have to shave between the patient's legs. One chlorhexidine wand covers a 13 by 13 area. That means that most patients will require 2 wands and some will require 3. The C-section incision site should be scrubbed for 30 seconds or 2 minutes depending on the site. A moist incision site is one where the fan and seal incision site is covered by an abdominal fold or pannus when the patient is lying flat on the OR table. A moist incision site needs to be scrubbed for 2 minutes before working out to the periphery. A dry incision site is one where the incision site is not covered by an abdominal fold or pannus. This surgical site can be scrubbed for 30 seconds before working out to the periphery. Tuck towels should be placed under the patient's sides and between her legs to ensure the chlorhexidine prep fluid does not get on the OR table. The patient should be prepped with her legs closed. The chlorhexidine wands should not be cracked in their package. The incision site should be scrubbed with friction for the required amount of time, either 30 seconds or 2 minutes. Using friction means that you should not just use a simple back and forth motion, but instead you should use small circles or up and down and side to side motions. Once the incision site has been scrubbed for the required amount of time, you can move up towards the fundus with the same motion, careful not to go back over the incision site. Once you reach the fundus with the prep, you should throw the prep wand away and grab your second prep wand. You may choose to go over the incision site again, but you do not have to. Using the same friction motion as you did when you were working up towards the fundus, move down towards the mons pubis. Then pick up the wand and prep each leg an inguinal fold. Finish your prep with the swipe between the legs and throw your prep wand in the trash. Remove your tuck towels from the patient's sides. And pull the towel between the patient's legs down towards the feet and not up towards the abdomen. The chlorhexidine prep should be allowed to dry for 3 minutes.